Good evening, everyone, and welcome. This is the second episode of our COVID Conversation Clinic, where today we're going to explore what has happened since the approval of the COVID vaccine in children 12 years and above, particularly in communities of color. We have an exciting program for you. You will listen to a video of some of our young children that have received the vaccine, and then we have a dynamic panel that I will introduce to you. So let's take it away and see our video.
I got vaccinated at New Beginnings Christian Fellowship in Kent, Washington.
I got vaccinated both times at two different Walgreens, in my area.
I live in Oakland, California, so I went to the Oracle Arena, which used to be the Warriors' home stadium before they moved to Chase Center.
I was very nervous to get vaccinated, not because the idea of it, but I am not a big fan of needles. So I was a bit scared, but my mom was there. She wasn't next to me, but she was in the vicinity, so it made me feel more comfortable. And afterwards, I just felt great because all the people who did it and were just there around me were so nice.
Yeah, I was so ready to get the vaccine. My mom is actually a pediatrician, so she had already gotten it. And I really don't mind shots. Surprisingly, I was just ready to get it. And I remember my friend also had her vaccine appointment the same day, coincidentally. So we both got ours on the same day. And I just remember it was so fun. And I went with my mom. And even though I might have felt a little soreness afterwards, I just was happy because I knew that that's what it was supposed to do and that the vaccine was doing its job in my body.
My experience was a little bit, I guess weird would be the best way to describe it, because I went to a drive-through one. So they had the National Guard there and some medical staff, and it was out in the parking lot, and they had a long line of cars going through. But when you got up to where they were giving out the vaccines, all the people were super nice and very informative and actually pretty funny as well. They were cracking jokes pretty much the whole time. And I don't really have any problem with needles. So once I felt comfortable around the people, I was just chilling there. And then we waited there for a while, since they have you wait 15 to 30 minutes to check if anything happens to you, if you start to get sick. And they had people literally just walking up and down the line, talking to the people in the car windows. There was this one guy who was cracking jokes about his time in the military. So yeah, it was actually pretty fun. Not what I expected, which is why I'd call it weird, but still good.
I did it mainly to protect my family, and me, especially since my younger sister is not eligible for the vaccine since she's too young. So just to protect our family and the people around us.
Yeah, kind of adding on to that, I just did it for one step closer to normalcy. I know that I had to do my part in order for other people to do theirs, and I just wanted to see my friends and see my grandparents, and I knew the only way that I would be able to do that is if I got a vaccine. So yeah, I just guess I did it to do my part and kind of get back into the normal things.
In addition to what Aaliyah and Karen said, I commute, so in order to take public transportation, or at least to feel safe taking it, I really wanted to get the vaccine, because since I go to school in the city but live outside of it, that's where a lot of my life and my hobbies and my friends are. So it was really important for me to be able to use that, especially because of how slowed down the DMV process became during the pandemic. It was hard for people who hadn't already started before the pandemic started to get their licenses. So yeah, being able to take things like the bus and Uber and trained safely was very important to me in my life.
I would tell people my age or older that it's very important to get vaccinated because it keeps you and the people around you safe. Plus, like Taryn said earlier, it gives you a sense of normalcy back in your life. So you're not just in your house staring at a computer screen for 90% of your day and then going straight to sleep or whatever. So on the weekends you can walk around or around people. So it's just helps so you're not feeling alone as much.
Yeah, I would say it's worth it and it pays off because I had a sleepover last night and it was so much fun. And I forgot what my friend's room looked like. And it's if you want to do those types of things again, go to the beach and hug your friends, hug your grandparents, just see family, travel, anything. Because I know a lot of people are oh, I can't wait till we can have prom, or I can't wait till we can have these things. Get the vaccine and then we can do it. It's kind of, I don't know, I just think it's worth it and it pays off, like I said.
Yeah, it's like my city just opened back up. 80% of our residents got vaccinated since they started handing them out. So they were able to just completely open everything up except for public transportation and some indoor businesses. And even then, when I say open up, I mean you can go where you want without a mask. And the only restrictions is that whenever you go on public transportation, whenever you go into certain indoor businesses, you gotta wear a mask. So it's you get to do all the things you were doing before the pandemic started again. When you get the vaccine, those numbers add up and they're counting. They'll see it in your city, you're contributing to that. And also for people who are athletes, being able to do athletic events and sports meets normally again is the most satisfying thing ever. As somebody who running with a mask on was awful. It was one of the most stressful things you could do, because when you're breathing that hard and you got to keep the mask on, you actually will realize that it can have an effect on your breathing when you're trying to push as hard as you can to get those couple seconds off of your time. And being able to just be completely free of that at a meet with no worries about whether or not you or somebody that you care about is going to get sick, it's just, yeah, it's like living normal life again. It's awesome.
What a fantastic group of young adults. They were wonderful. And so now to add to those wonderful comments, that's very important. I'm going to bring you our panel of pediatric experts, and they're going to discuss with you topics that why our parents should consider getting their children vaccinated, what to expect when your child gets vaccinated, and also the approval process for the pediatric COVID-19 vaccine. This is really a conversation. And so I'm going to give you some brief words about our pediatric expert panel. Their bios are listed on the screen so that you can see all of them. But I'm just going to give you an overview for each one, because we want to have this discussion so you can be informed and you can take the proper action to protect not only your children, yourselves, your family, and your community. First up, we have Dr. Merlin Robb. He is the Chief Medical Officer at the Henry Jackson Foundation for the Advancement of Military Medicine, the COVID-19 Clinical Advisor, as well at the Walter Reed Army Institute of Research. Following him, we have Dr. Likia Peralta, who's President and CEO of Casa Rubin Incorporated and the MIT Sloan Fellow and Researcher. Dr. Oliver Brooks, the Chief Medical Officer at the Watts Healthcare Corporation and past president of the National Medical Association. And rounding out our panel, and no, she's not my cousin, but we'll claim it, Dr. Samira Brown, who is a pediatrician and co-founder of Little Lives PPE. Welcome, panel, and let's get started. I'm going to give you an opportunity to each say some things that I may not have included in my introduction, as well as something about the pediatric vaccine and where we are, and then I will launch into questions that we already have, and we will also take questions in our chat box. So let's start off. Since I started with one name, I'll give Dr. Brown the opportunity to start first and say a few words. You have to unmute yourself.
Thank you so much. It's great to be here. I am a primary care pediatrician currently practicing in Atlanta for Piedmont Healthcare, and I'm also the co-founder of Little Lives PPE. Certainly, this vaccine is a sigh of relief for us as pediatricians because we are here to stand up on the safest side for children, and certainly having them vaccinated against COVID-19 is the best way to prevent disease and all of the things that can come with COVID. So really excited to be transparent about what we know about COVID and what we know about the vaccine so that families can make a good decision.
Okay, Dr. Rob.
Thanks so much for this opportunity to participate in this really important endeavor to provide information and answer questions. I'm greatly honored. I'm a pediatric infectious disease specialist. I really haven't practiced pediatric infectious disease. Mostly I've been doing research in international venues. And in the last year, 15 months, I've worked almost exclusively on COVID-19 vaccines. And because I'm a pediatrician, I'm very specially interested in how we can get these vaccines to our children. It's a great opportunity to be here. Thank you so much.
Dr. Peralta.
And I am a pediatrician and also an adolescent medicine specialist. And I have basically done clinical trials my entire career since 1992, engaging young people into research and also dealing with chronic illnesses and viral infections. I am so delighted to see the young voices from 12 to 17, how articulate they are, how committed and passionate about taking care of their families and their communities. They are the best public health voices that I have heard in a long time. Oftentimes we forget the impact of the pandemic on their well-being, emotions, and development, and they all lay that out in that video for us. And I hope that we remember those strong messages when we also talk to the parents.
Thank you. Dr. Brooks.
All right. Thank you, Dr. Brown, and happy to be on with such distinguished other pediatricians. I have been an advocate and working in the realm of immunizations for about 15 years. I find it fascinating that we've been working relatively in the shadows for all this time, and now every day on the cover of the newspaper or on television, you're hearing something about immunizations and vaccines and herd immunity and vaccine hesitancy. So I'm glad it's out in the forefront, and for a good reason that we have these vaccines. And now we have the vaccines for children. I do want to echo what Dr. Peralta said. Those young voices are probably some of the most intelligent, thoughtful, forward-thinking, and real time from the heart statements. Why they wanted to get vaccinated was a mixture between good for themselves and good for the community and good for their families. And that is the essence of this vaccine. That it has many benefits, not just protecting me or my family, but our community. And as African Americans, we really need it. So I do feel good about the way this is structured and look forward to the question and answer period.
Thank you so much. Let's sort of go back a little bit, and I want to also echo not only a thanks to our young panelists, but also the parents for really instilling in them the selfless act of looking out not only for themselves, but their family and their community. And I think this is what it's all about, having to wear a mask and social distancing and all of those things that we are really tired of, but it's important until we get to a significant percentage of individuals that have received the vaccine. And of course, with our children, in a couple of months, school will get ready to open and children will be going back. And so we have to really be concerned making sure that they have the vaccine. So I'm going to ask this first question for Dr. Rob, because you've been engaged in the research arena with the vaccines. What do you know about the vaccines that's based on children that are entering the clinical trials and the data that's out? Can you speak to that just to make our audience feel comfortable?
Sure. So, the federal government supported 6 vaccines, and they chose those vaccines and those manufacturers, those companies, because of their ability to scale the production and distribution of the vaccines. And they had 2 for each platform: mRNA vaccines, subunit protein vaccines, and viral vector vaccines. Now, the differences between them, one was brand new, one well-established, and one that has a fair amount of experience, but not actually licensed yet. And that was a kind of a stroke of genius, and things moved around very fast, because we cut corners for safety, but we put money behind activities in parallel so that we were able to move into efficacy trials within months of identifying the causative organism, the virus that causes COVID-19, SARS-CoV-2. Of those 6, 3 have achieved emergency authorization, which has allowed them to be used in adults 18 above in 2 cases. And for Pfizer, they did their original study down to age 16 and received authorization for 16 and above. That's great news. It's had a huge impact in communities, as we heard from our outstanding, the testimony we got from the children earlier. The data that we've got so far that supports their use, Pfizer is authorized now, and Moderna has submitted an application to the FDA to be authorized for 12 and above. And what we're seeing in those age groups is an excellent safety profile. They have similar reactogenicity to what is seen in adults. And very impressively, they get excellent immune responses. If anything, they're at least as good or better than adults. And although the studies are much smaller, we still got a clinical signal. We still had some cases of COVID-19 in the placebo arms of those studies, and can say that almost all the cases occurred in the placebos. So it protects against disease as well as producing the kind of immune response and safety profile that we see in adults. I'm sure we'll talk about myocarditis at some point. It's very, very rare, and it appears to be transient, and it's too early to say whether there are long-term issues, but it's very, very rare, well tolerated, doesn't require a lot of treatment. And so generally speaking, it's very, very encouraging. And compared to the risk of COVID-19 in that age group, 12 to 17, the risks are much, much smaller for the vaccine than acquisition of the disease. It strongly favors going ahead and getting your children vaccinated to protect themselves, both for COVID-19 and also for the inflammatory syndrome, multiple inflammatory syndrome of children, which occurs 3 to 6 weeks after COVID-19. Both of those things are big problems in adolescents, much, much more common than any of the side effects we see with the vaccines.
Thank you, Dr. Rob. Now, here's a question that for all of my pediatricians that are seeing patients now, and your parents are coming in and they say, why should I get my child vaccinated? The rate of hospitalization's low and death is low. Why should I get this vaccine? It's just about over. What's to worry? So which one of you would like to take that number? can take yourself off mute. Should I call on someone? Dr. Peralta, Dr. Brown, Dr. Brooks? Who wants to start with responding to that question?
I can start.
Good,
So
thank you.
For the young people set up the stage for us at a personal level and at a community level. We should give that answer, right? The adolescents 12 to 17 years of age are at risk of severe illness from COVID-19. We know that the younger ones may have less symptomatology, less symptoms, but we know that the risk of severe illness and complications are in that age group, 12 to 17. So over 1.5 million cases and more than 13,000 hospitalizations today. So we are talking about a large number. That's a lot larger than the infamous H1N1 pandemic that we had years back. And also what we already mentioned is the multi-inflammatory syndrome in children is more severe in adolescents than in younger children. But one thing that, again, we forget, and the young people in the video were very eloquent about, is the impact of the pandemic on their well-being, on their emotions, and their development. Adolescents are social beings. They are now getting out of the cocoon and becoming independent. This is the time when we had to be with their families under the same niche for long time and not interacting with their peers. So this is an opportunity at an individual level to give them back the opportunity of getting back into their well-being and their normal lives and development. The second part is like what they already mentioned. Adolescents and children are not immune to SARS-CoV-2. They also get COVID-19. So adolescents contribute to the transmission in communities, at school, and the households. And they also are going to be able to transmit to other vulnerable populations in their own household or beyond. So they represent right now an increasing proportion of the COVID-19 cases. And as of the last, I believe the numbers from 12 to 29 years of age, adolescent and young adults have the highest incidence right now, like 7.7 million cases. So we are talking about controlling the pandemic, thinking about the others like they expressed to us in the video. So at the personal level, getting them back to normal, getting them back to their development, avoiding hospitalizations, mortality, and also the severe illness. And at the same time, is taking care of others and the community and stopping the pandemic.
Thank you so much. Dr. Brooks, can the vaccine change your DNA?
No. Can the vaccine change your DNA? The
Yes.
answer is no. The two vaccines, well, right now it's just the Pfizer, but as stated, Moderna is getting EUA, has applied for emergency use authorization. No, this is an RNA, a messenger RNA vaccine. What it does is it codes for a protein that mimics the virus. So it never goes into your DNA. Basically, your cell is like a ball, let's say a basketball, and on the inside of that cell is an orange. So the orange is the control center of the cell, and the outside is the basketball area. The vaccine goes into the outer area where there's machinery that makes proteins, and it kicks out protein, and the immune system reads it as if that's the virus, and it primes the immune system with antibodies and cells that are ready to kill the vaccine. So it never gets into the DNA, which is the nucleus of the cell. So that has been something that I've heard a lot about. I don't know exactly where it came from, but I think it's important that if you are worried about that with your child or with yourself, it is wholly inaccurate and does not occur.
Okay.
And Dr. Brooks, can I mention something that I heard on the video? Is that one of the young people mentioned about the vaccine is doing what it's supposed to do. I was so excited to do that. It's talking about what you just say, Dr. Brooks, in their own words. And one of the things that my patients have taught me is that, oh, now I get it. It's like a recipe. It's like the transport takes the recipe to my cells. I'm going to make that like mimicking like that protein.
Yes.
Yeah, and one other thing that when she was speaking, let's just add, and importantly, why should children get vaccinated? About a 20 to 25% of the U.S. population is 18 and under. So ultimately, if we don't get that age group vaccinated, we won't slay this virus. And the one other thing that I think is overlooked a lot is people that are unvaccinated are more likely to get severe disease. And if you get severe disease, you're more likely to have long COVID. And the thing I worry about more than anything, I figure I'll beat the virus. I may get hospitalized. I'm not going to die. Okay. I still may, but I don't plan to. But I don't want long COVID. I don't want symptoms of COVID-19 2 years from now. And again, for those people that are kind of cavalier about it, well, 99% of people that get COVID don't die, don't get hospitalized. Sometimes you don't even know you have it. Yeah, but it can come back 6 months later, or it can stay for 6 months to 2 years. So I think that people need to not be cavalier and comfortable thinking that this is a benign infection. This is not a benign infection. So have a healthy respect for SARS-CoV-2, the virus.
I would just add that, and Dr. Peralta referred to this, if you look at a bad RSV year, respiratory syncytial virus, and a bad influenza year like H1N1, put them together, that killed less adolescents than 1 year of COVID-19. So it's a disease that, as Dr. Brooks mentioned, it's a terrible disease. Even if you never go into a hospital, you may have a loss of smell or taste, other problems that, or this long hauler syndrome or with COVID that lasts for a very long time. So prevention shortens the vaccines prevent, but they also, if you do get infected, you have the disease for a much shorter period of time, much milder symptoms, much less likely to transmit to others.
Yes.
And if I can add, we know that there are over 4 million multi-generational homes here in the US. So absolutely protecting our children definitely protects our entire community. And we certainly need that, especially in our Black and Brown communities. And when we think about the complications of COVID, like my fellow doctors are saying, it absolutely is not harmless in children. And we're learning more and more about this virus. And it's really important for families to understand, right? There have been over 3,500 cases of MIS-C, or that multi-inflammatory system. 1 in 100 children who have that lose their life. COVID-19 is in the top 10 causes of death in children. And that has to be talked about more. And vaccinating is our way to prevent that. And that absolutely is our job.
Yes. Thank you so much. And we'll come back to talking about the MIS-C and the myocarditis and the pericarditis in just a moment. But Dr. Brown, let me ask you a question in reference to the vaccine, because you have to get 2 shots. And we're getting kids now to say, why should I get 2 shots? I mean, do they need both of them? And we know that with the vaccine that has been approved for children, it is both the Pfizer and Moderna is a 2-shot vaccine. Can you speak to why we need 2 doses?
Absolutely. So that's a great question, and one that we get very commonly in the office. I know that certain adolescents, they would love to be able to just get one, me, myself too, but I'm not a lover of needles, but I definitely love the protection that it affords me, right? And so the level of protection that you're able to get to is significantly different with 1 shot versus 2. And that's exactly the reason why you need 2 shots if you're getting the Pfizer. And certainly that is the vaccine that's approved down to 12. And so if you're going to get into that over 90% protection, which is incredibly good, right? And protects against every single variant that we have seen here in the US, you have to get both to be able to get to that level.
Thank you so much. Now let's talk about the safety and testing of this vaccine. Dr. Rob, was there enough testing of safety and efficacy in children? And I know we heard that, oh, well, now the adults are getting it, let's give it to the children. And we didn't hear a lot about the studies that were going on for some time in children. Can you speak to that?
Well, it's traditionally the case that the vaccines, if the adults and the children both have the disease, there's a tendency to start in the adults and prove that it's safe and efficacious, and then move down, from older adolescents to younger adolescents to school-age children, toddlers, and infants. And that is true not only for vaccines, but also for other drugs and medications. And that's the process that's been followed here. The FDA articulated early on that they viewed 16 and 17-year-olds as very similar to adults, and that was what gave Pfizer permission to include those 2-year age groups in their efficacy trial. Since then, though, the other two companies have the 12 to 17-year-olds are being enrolled as a block, 16 to 17 first, and then 12 to 15. And that those two companies are Moderna, who, as we've said, has got enough data from that study to submit to the FDA for emergency use authorization, and the data looks very, very good. Novavax, which has a subunit vaccine, does not have an emergency use authorization for adults, but they have completely enrolled a study for 12 and 17-year-olds. So I expect that when they put in their data for an emergency use authorization, they will also include the data, which is about 2,000 young adolescents and teenagers into their safety database and efficacy database. Now, we didn't think that there would be enough symptomatic disease in the teenagers that we would get what we call a clinical efficacy signal to show that we actually decreased symptomatic COVID-19 in those age groups. We depended more on showing that the safety was similar to adults and the immune responses we elicited were non-inferior. And in fact, what we've seen is that they're at least as good or demonstrably better. Not surprising. Very often, children and adolescents respond better to vaccines than adults. And so I think that the safety database and the immunogenicity database was adequate. And surprisingly, and very encouragingly, there was enough symptomatic cases in the placebo arms that we could say confidently these vaccines work in these age groups. The challenge we face is the safety issues, both in adults with the thrombocytopenic thrombotic syndrome and anaphylaxis that we saw with the RNA vaccines occur so rarely that you get an initial amount of data, and then you have to follow people very closely as you deploy the vaccine using the various systems that the CDC has set up to survey for unusual rare events, and then put them in the context of how big a risk is this and what are the benefits versus the risk. I think I'd love to hear what the others in the panel say. I know Dr. Brooks is part of the ACIP, and you guys were specifically asked this question. Are the studies big enough? Should they be, much larger? And I'd love to hear your opinion. My view is to make them larger, to find something rare, they're gigantic, and we would still be enrolling participants, not nowhere near where we are today enrolling this out. But I'd love to hear what the other folks say.
Yes, other panelists, would you like to speak to that? You have to unmute yourself.
Yeah, thank you. So I think there are a couple of things that we need to keep in mind. First of all, on the broad perspective, the reason why we're having less death, less cases, less hospitalizations because of the vaccine, period. It's not because we had good hand washing and good mask wearing and good social distancing. That helped. But the vaccine is why we are where we are here. Number two, generally the way vaccines are often developed they are first in adults, and they're called bridge studies, where the information that is found in terms of safety and efficacy in adults is brought over to the childhood population and therefore the numbers are less. Yeah, we would want more, but I am satisfied with the numbers. And number three, if we waited to, let's say, get 10,000 children enrolled, that may take another 6 months, which means then we're going to have tens of thousands of dead children. So I am comfortable with where it is. The vaccine has been out in the United States. I don't know how many doses, 200 million, maybe more. One of these esteemed individuals know that. No, we have enough enrolled, and the vaccine is safe and effective. The ACIP has looked at this closely. And I also want the people that are listening to this to understand, we're all pediatricians or pediatric advocates. We're not, we are feeling that this is the best for our community, for our patients, indeed for our family. This is not something that someone told us to say. We all sincerely believe the science and the evidence. So I think that that's kind of important for your audience. This is not someone telling us to do this. This is what we believe, and we believe it passionately.
Thank you.
And if I can add in there, there have been 7.7 million children who have gotten the Pfizer vaccine already. And, using VSafe and the VAERS system to report side effects helps us be even safer. And that's how we know about things about side effects, and that we know that there are no serious side effects to this vaccine and that it's efficacious. But that is a good number of kids who've already gotten at least one dose of the Pfizer vaccine. So I think that too is really important for families to understand, that a lot of kids have already been vaccinated safely.
Yes, and the side effects have been very limited. There's a lot of misinformation, since you brought this up, about the numbers that have gotten the vaccine, and the safety, VSafe and the VAERS system that's reporting the data. Part of that misinformation centered around the fact is that CDC is collecting this information, but they're not telling the public because they don't want you to know. We know about the myocarditis and the pericarditis, rare instances. We haven't, at least I've not heard of any of the thrombocytopenias that we've seen in some of the adults. Would you like to speak to that in terms of the data that's out there and how it is reported? I think it's very open, but there's a lot of misinformation. So who would like to speak on that?
I'll just start setting up the stage, because I think each one of us should be talking about this, since we have so many experts on the panel. But since April 2021, there have been increased reports to the CDC of the cases about inflammation of the heart or the membrane of the heart. And as I guess as of June 11th or so, we have over 300 million doses of the mRNA vaccine in people's arms. So we are talking about a huge number. And with that, in that, since April 2021 up to June 11th, basically is like 1,200 plus reports of myocarditis in a very wide range from 12 to 39 years of age. And this is important because when we talk about adolescents, we are going beyond for that CDC report of the 12 to 39 years of age. And that causes a lot of confusion to our parents and the community. So when you look in simple terms in males between 12 to 39 years of age who got already that vaccine, the risk of myocarditis after the second dose of the mRNA vaccine was like 32 cases in a million. And when we talk about females, it's like, a little bit more, 4 cases per million. So we already mentioned that this is a rare phenomenon. And in contrast, those individuals 12 to 19 who we really care so much about it, they are the ones who are being affected by severe infection and by the inflammatory syndrome in children that produces myocarditis. So 1 in every more than 3,000 COVID-19 infections get this type of syndrome between ages 12 and 17. So the risks of getting the infection and getting other complications, including myocarditis and the long COVID, like we already mentioned, is a lot higher than what we are seeing with those reports. So it's predominantly in adolescents and young adults, up to 12 to 39. So that's a big range. More often in males, more often following the second dose, and typically within 4 days or so after the fourth day of vaccination. So we are talking about a rare phenomenon. It's usually that inflammation is transient and self-resolving, like we already said, and they could go back. Most of the time, it's just restrictions from sports, and they could go back to sports once they are clear within 3 to 6 months. So the benefits are a lot larger than the risks of this vaccination. We have to be very clear about that, and that we support giving the vaccinations to 12 to 17 because this is the right thing to do, protecting them and protecting communities at this point.
Yes. Does any other panelists wish to add to that?
I think that's
good.
I think that it's such a great point, that how rare it is, right? And so that that you can watch for those symptoms. So oftentimes myocarditis and pericarditis can present with fever, chest pain, shortness of breath, sometimes skipping of beats. And this is something that you can call your pediatrician if your child is suffering from these symptoms and be evaluated the same day. An EKG and labs diagnose it very quickly. It comes right back. And oftentimes this can actually be treated with over-the-counter medicines, non-steroidal anti-inflammatory drugs, so naproxen or ibuprofen, and these kids get better. Oftentimes don't necessarily need hospitalization, and like Dr. Peralta said, they will be on, restriction for about 3 to 6 months. But the myocarditis that comes from a natural COVID infection is much more common and much more severe. So I would definitely encourage you to still vaccinate, because again, this is, 4 in a million for girls, 32 in a million for boys. It's extremely rare, self-limited, and mild.
Yes. I have a question here in the chat box that the person is concerned that if they wait and not get the vaccine now, and maybe they are adolescent, can they then get it when they become an adult? Of course, they run the risk of being exposed to the disease. So would one of my panelists love to address that?
Well, I'll address that, certainly. If you're unvaccinated with the thought that this virus will be circulating for years to come, which I expect it will be, though we don't know. I mean, don't forget, it's called a novel virus, and that for a reason. But if you are unprotected, unvaccinated, you can get the infection anytime. So yes. So if you make the decision for your child not to get vaccinated, or you choose not to get vaccinated, you for sure can get infected and run the risk of all the problems with having SARS-CoV-2 infection.
Okay, thank you. Dr. Brown, what safety measures would you recommend for the unvaccinated children in the home that may be under the age of 12? What measures should the family take?
Yeah, so, we have not changed our recommendation for kids who are at home who are unvaccinated, right? They are still at risk. And oftentimes you also want to consider the developmental stage of those children, right? In order for them to be consistent when they're around others, especially indoors. That's the highest risk. If they're indoors in a public space, they need to continue to social distance, and they need to continue to mask. And so help them out, You can also show them how to wear a mask, as we have been throughout this entire pandemic, and they can do it phenomenally well with a lot of positive reinforcement. And when they see you do it, then they know that they can too. And oftentimes then they become the teachers, but our recommendations really have not changed. So you want to make sure that those kids are still getting outside, getting their exercise, and social distancing from others, really to continue to protect them. And certainly if you have children who at home who are at high risk, right? So if they have asthma, if they have chronic lung disease, sickle cell disease, you want to vaccinate around them. So your loved ones that are coming to your home, they need to get vaccinated to protect your family. So really make sure that you're reaching out to those that you would like to socialize with, and make sure that they understand that they too can protect themselves and your loved ones by getting vaccinated.
Okay. Would others like to comment on that? No? Okay, let's go to another question. If there's someone who's afraid of getting the vaccine for themselves and for their children, how can we help them and their family members to help them to feel more comfortable about getting this vaccine? And that's for anyone on the panel.
Yeah, well, that's the $64,000 question, seriously. Because the basic concept is that vaccines don't help people and save lives. Vaccination helps people and saves lives. So first of all, the way that you approach this is determining what their concern is. Everyone has a slightly different nuance as to why they don't want to get vaccinated, why they want their children to get vaccinated. So you have to listen to them and also assume that they are reasonable. And by that, I mean, it's not just because they want to be difficult. It's something they truly believe. Mothers, fathers love their children. Okay. So then you listen to them and then you address their concerns. Do note that not getting vaccinated generally is an emotional, psychological decision and not a scientific decision. So you need to know your science when you're talking to someone, but understand that facts and figures will not get them to where they need to be. So I will say, I'm vaccinated. I vaccinate my patients. I've read the studies, the vaccine is safe and effective. And I always say I am more afraid of COVID-19, the disease, than COVID-19, the vaccine. And if you cannot get someone to get it, get to the heart, because it's the heart, not the brain, that's making these decisions for these people, then you're going to have a hard time. So appeal to their heart and to what their belief system is, and take them seriously. Don't look at them as if there's something wrong with you because you're not getting vaccinated.
Okay.
Dr. Brown, there is something I would like to share with the person who asked that question. And all of us know that everyone who wanted to get vaccinated and had perhaps, no fears, and they had their decisions made, already got vaccinated, is what I call the low-hanging fruit. Everybody got, to the massive centers. However, now is when we are dealing with the fears of our community or the barriers of our community. Many people who have 2 or 3 jobs, others who have, for example, have no time. They're so exhausted, they lost their job, they just gained their job back, and they cannot get, to a vaccination center or get an appointment. But also those who have chronic illnesses, and we have vaccination center for Black and Brown communities in our state, really matching effort with the counties. And what we are finding is that it takes now longer. It takes longer to be able to communicate with the patient and talk, like Dr. Brooks said, about their fears. So it's not like in the old times when everybody went online and just got their shot. Now it's different. It's a very different mechanism. And that's why we are talking about this, but also that's why we are taking it to our community now, because in the past, pediatricians had no access to the vaccines. Primary care physicians had no access to the vaccine. This is just happening now. So we know from many studies, including the last one from the Kaiser, that people trust their physicians, they trust their healthcare providers in the community, and that's where they get the time to be able to talk about all their fears and hesitation. So we understand, we hear what you said, and I totally want to echo what Dr. Brooks said, is that it takes that one-to-one from a trusted source to be able to talk about what the real issues are, so you can spell the doubts and be able to accept not only the science, but emotionally accept what you are getting into it, but also how you are protecting your family, including your children.
Yes. Anyone want to add to that?
Now, I would say I see a lot of families that are worried that I'm going to be upset, or, is your pediatrician going to be mad at you because you don't vaccinate? Our job is certainly to educate you on what we know, what evidence we have, and to answer your questions and respect the decision that you're going to make for your family, because we want to make sure that you make that with the best information that's available. And that's exactly what we're here to do. So absolutely call your pediatrician, make that appointment, and ask any question that you want. All questions are fantastic, great, and we can answer them. And if we don't know the answer, we're going to be honest about what we don't know as well. That's really important.
Good. So Dr. Rob, are you going to add something to that?
Let me unmute. I was impressed with all those answers, and I think openness, transparency, and a neutral and non-judgmental approach to the patient and the family is really, as they've all said, is really the critical first step here. And sometimes it's a multi-step process. The first interaction, they don't walk away saying I'm going to get the vaccine, but they come back, they think about it. So we have to leave the door open.
Yes.
And instead of asking someone else in a 1-800 number, they have a pediatrician, the source in the community to go to.
Yes, that's right. Thank you all so much. A question, because we are all from communities, and we know that not all of our communities of color have the same access to resources that are there. And we talk about the social determinants of health and how it impacts the lives of our family, and particularly our children. So I'll start with you, Dr. Peralta. You speak to the social determinants and getting the vaccine and their ability to get the vaccines. Also, in terms of, as you mentioned, pediatricians, we know that with the Pfizer vaccine and the Moderna vaccine, you had to have a facility that would keep it at a certain temperature. Of course, that's changing. The Johnson & Johnson vaccine was one that may be able to come to the community, and there's some questions around that. So can we talk a little bit about access and how it impacts our children getting the vaccine? Because right now, the only vaccines that are available for the children are the 2-dose vaccines.
So in general, we pediatricians know that unvaccinated children are more likely to be uninsured or underinsured, and this is of particular importance in immigrant communities, for example. Also families who live below the poverty level, they reside in rural areas, or sometimes also, most of the time, they lack transportation. It takes a long time. But the parents, like I mentioned, who work 3 or 4 jobs, or they just regain their job now. So those are major barriers, but they are 2 barriers that I would like to share with all of you with my hat as working with the Latino community and the immigrant community, is that the language barriers could be a major problem, and we know even that could impact mortality. And one of the the studies done in Boston with COVID-19, but also the immigration status. It's very difficult to do research related to immigration status because it's complex and often, incomplete. But many immigrants during this pandemic were and are still concerned about receiving health benefits or aid of any kind, by the way, because they had fears of receiving public benefits, which could make them ineligible to a path of obtaining their immigrant visas in the United States. And this was particularly important in the last administration, because this was reinforced, and many parents, who were being affected by COVID-19, decided that they were not going to seek care, that they were going to stay at home and battle as they could, because they were afraid that that was going to be reported to the federal government. But also that, access is what we see in terms of numbers of vaccinations for people who are Black and brown. This is technically what we call public charge. When you obtain public benefits, and then when you go to get your immigrant visa, that's going to be showing there as a benefit that you were not supposed to get. So this is a major concern in the Latino community, and they perceive that up to now they could be tracked by immigration authorities. So this is part of why pediatricians, people in the community, community clinics are important center and safety niches for those individuals who really feel that their data could be going beyond what we use it for, which is just to vaccinate and to make sure that we track the patients and their side effects. But this is a major concern, especially in the community. And the fact that many people lost their jobs, the unemployment went sky high. Our people, Black and brown, were the workforce that were in the front of this pandemic, and they were disproportionately represented there. So unfortunately, we have now to take the strategy to a community level where it really belongs. And from the beginning of the pandemic, I've been talking about this. I said, our people are going to be the last because of the access to healthcare, because of the gaps in insurance, because of the not having insurance at all or not being eligible. So this is the opportunity for us to do that work. And although it's hard, I think that this is the time now, especially with my colleagues here, to continue pushing for vaccinations in the community level where they can feel safe and they can find the trusted source where they can get vaccinated.
Thank you. Let's ask another question in reference to younger children and children going back to school, particularly for those under 12. So, Dr. Rob, are there any studies currently going on that's getting data that we might be able to utilize for the children 12 and under as we get ready for school opening in the fall?
Yes, there are. There are two studies. Pfizer and Moderna both have studies in age groups, I think 5 to 11 in one case and 6 to 11 in the other. I believe the studies are still enrolling. It's possible that Pfizer's completed enrollment. Now, I'll just say that the FDA's standards for emergency use authorization are not very different in some important respects than what is required for licensure. You have to have a high level of efficacy, and all of the vaccines have greatly exceeded the threshold in that regard. And you have to have a certain body of safety data. And the safety data would be 1,000 participants per age group, and at least 2 months half of those children have to be followed for at least 2 months to get a safety signal that allows us some reassurance that we can go forward. For licensure, it's 6 months of follow-up because we're in a pandemic. This is a very bad disease. It has great consequences for young children, school-age children, and certainly, as we've been discussing, adolescents. When do we expect to see data, given those general parameters from the 2 studies? It'll be later this summer or early fall.
In time for school.
Close, maybe.
Close.
Importantly, there is no vaccine for children over years of age.
I'm getting an echo, Dr. Brooks.
Oh, are you getting an echo now?
No, it's fine. Go right ahead.
Okay, good. So these children, I mean, it's interesting. These are tough questions. These again, all questions regarding COVID-19 are tough questions because, a year and a half ago, it didn't exist. Children under 12, in my opinion, do need to go to school. At some point, I mean, you can debate whether they should have virtual classroom versus in person. But children are not doing as well as they were prior to COVID. Therefore, what the CDC says is under 12, elementary school, 3 feet of distancing, social distancing, masking, good hand washing, screening for symptoms, and don't come to school if you have fever or cough or whatever you're looking for. So I think we really have to look at the fact that come the fall, we may not have a vaccine for children under 12 years of age, and probably, quite frankly, we won't. And we have to look at how they're going to come back into the classroom. And I'm curious as to how the other pediatricians look at this. Pediatricians clearly know that children get more than learning in school as it relates to academics, but they learn socialization. They learn how to interact with adult authority. They learn game play, interacting in terms of when children play, they learn how to interact in terms of games that are teams. So all of these things are part of schooling. So we really have to start looking toward August/September and these children coming back into the classroom. And again, African-American children, tend to have, let's say more issues. Their schools have less money. So, you need good ventilation in the schools. Their parents may be less likely to have them at home. So they need to be going into the classroom. So this is what I think an area where we really have to have some focus.
Other comments from my other panelists?
I would definitely, echo all of that, really. So we have to be careful about kids going back into the classroom because they're not going to be vaccinated under 12 and those even over, right? We have not seen a high level of vaccination even in 12 and above yet to say that even 12 and above are fully protected, right? So one, you want to make sure that your school staff, that they're getting vaccinated. And if they're not, that they're requiring masks for their teachers. Dr. Brooks, you make a great point about ventilation. That's incredibly important. And then what is your school doing about the ventilation in the school? Because that certainly has been shown to reduce risk, and continuing all those other preventative measures. Adding testing on a regular basis to schools also makes it safer to be back in class, in addition to having the kids space from each other and mask. So certainly it can be done in a safer way, but we have to really advocate for our community so that schools are really up to standard with what we know can prevent COVID as much as we can.
Okay, thank you. Another question. Let's see. I want to talk about the variants because you're hearing a lot in the media and certainly on the news. Does the vaccine that we currently have for our children protect against the COVID-19 variants, including the Delta variants that I'd like for you to separate out the other variants that we've seen, then the Delta variant? So who would like to start off with that?
Well, I'll start with that. There's some great real world data from Israel and the United Kingdom where they have nationalized medical services. They can track everybody who's gotten vaccinated, what they got vaccinated with. and they, have a centralized system for diagnosis of COVID-19 and characterizing the viruses. And very reassuringly, we saw that both the AstraZeneca vaccine, but in particular relevant to us, the Pfizer vaccine, affords a very high level of protection against all of the variants, including the Delta variant, which arose in India. Very high against hospitalization. Now, it's not quite as effective as it is against the more common variants that have been circulating in the United Kingdom and that are now circulating here in the United States. But it is, to me, very reassuring that the vaccines will cover those. Now, the thing is, we're in early days. People are getting vaccinated, and we're near the point where they have their highest response. So the question and the concern is, will that wane over time, and will the variants, have a resurgence as antibody levels of protective immunity declines over time? But I'm still confident that we're going to be able to protect against severe disease. And back to a point that came up earlier, one of the striking things is protection against that Delta variant is much lower after one vaccine. So it's really important to get both vaccines. It goes from 30% to about 80, in the 80% range for the Pfizer vaccine.
Okay. Can I add that we need to be very clear, and I'm going to use Dr. Brooks' style. If the adults are not getting vaccinated, especially in some jurisdictions, in some areas of the country, we expect that variant is going to be prevalent there too. We expect that it's going to happen. So we want to make sure that this is a call for action, not only for the adolescents, but also for the adults who are listening to us, because the variant primarily is coming from individuals who are not vaccinated. And we know that the vaccination rates in our Black and brown people have been low, and we have been trying to do the best that we can, but still low. So this is the opportunity for us to give the message straight. We need to be able to protect our communities. This is the time to do it. When we were talking about this initially, I was thinking like, wow, we are doing this, this webinar now, but this is the opportunity because we are heading into the summer and we are preparing our families, we are preparing our children to go back to school, and we want to make sure that they are safe and that this variant is not going to take over our communities. So this is the time to do it.
And Dr. Brown, there are a couple of points that I'd like to make on this. And first of all, Dr. Rob mentioned Israel. So the studies in Israel also showed that the vaccine, forgetting the variant, tends to reduce transmission, because I think that's something that people kind of forget, that early on we did not know whether the vaccines actually stopped you from spreading it, but the Israel data is showing that. Number two, I just really read today in California, or in LA County, of those that were diagnosed with the Delta variant, 92% were unvaccinated, 8% were vaccinated. None of the vaccinated had any significant illness. And third, this is an academic question. And by that, I mean, whether or not the vaccines that we presently have available protect against the Delta variant or not, that should not in any way influence your reason to get vaccinated. So I just want people to understand, if it didn't protect against the Delta variant, you still should get vaccinated. If it does protect against the Delta variant, you should get vaccinated. So I just want people that are listening to understand that aspect of this discussion.
So the bottom line is you should get vaccinated.
Yes, I agree.
Yes, that is really what we're saying. And because when the virus is around, it tends to mutate, and that's why we have variants. So
Right.
Getting the vaccine can stop the virus. And of course, it's not going to prevent the transmission 100%, But we know with the vaccines that are available, we are in that high 90%, certainly in 2 of them, and in the 80%. And as Dr. Rob has indicated, with the Delta variant, I think with following the second vaccine, you're getting at least in the 80 percentile range of protection. So yes, that is very true. Let's move to another area. Advice that we want to, and I think we talked a little bit about children. Let's go and talk a little bit more about myocarditis. And we know that it's mild, but if you have a young man who is going to go back to school and he's a sports person, so he's going to play soccer or football or basketball or one of those things, and you're concerned because it does happen in males, what would you recommend to that parent about, yes, should you let your child play sports? Should you get the vaccine? What do you recommend for that parent? Who wants to start?
Well, I'll just very briefly say the myocarditis, as said before, I think by Dr. Brown, the myocarditis associated with COVID-19 is devastating, along with a whole host of other problems. Athletes, student athletes, young athletes, we want them to go out and do their thing. That's part of growing up, part of exhilarating, exuberance of youth, and we don't want to deprive them of that experience. That's really, really important. And the safest way to do that is vaccinated. And the myocarditis is very rare. It appears to be transient and easily treated. The risk-benefit ratio is just overwhelmingly. You can honestly tell that person, if it was my teenage boy, I would have him vaccinated.
Thank you. Any others to comment on that?
Yeah, I mean, I 100% agree. And certainly we would still recommend that they get vaccinated because, again, you want to remember that myocarditis from COVID infection is much more severe than it is from the vaccine, and much more common from natural infection than it is from the vaccine. So again, 32 cases in a million for males, 4 in a million for girls. So it definitely is safer to be vaccinated than to go back unvaccinated. And certainly we absolutely want our students to get back to their activities and that heart healthy exercise.
And let me add one other thing, Dr. Brown. A lot of schools and teams may end up having, I won't say a mandate, but there will be a concern if a student is not vaccinated. I mean, think about soccer and football and basketball. You're all up on top of each other. There is no social distancing in these sports, okay? And so the risk of transmission if people are unvaccinated is higher. And then the statement was made by Dr. Rob, benefit risk. That's benefit risk ratio. Wow, it's just a lot of big words, quote unquote, statement. But the bottom line is the benefit outweighs the risk. You put on a seatbelt because the benefit outweighs the risk. Yeah, you're worried if you drive off a bridge and you need to get your seatbelt off because you're drowning in the car. Right. So therefore, I don't wear a seatbelt because I'm worried about driving off a bridge into water. I can't get out my car. No, that doesn't make sense. So a lot of decisions that we make in life are based on benefit risk. So the benefit clearly outweighs the risk. And all the statements that were made are true. COVID-19 is much worse than the concern regarding things that happen with the vaccine.
I would like to share something that I hear from parents in the community while I vaccinate. And one thing is that they get concerned about the messaging, and they think that we are talking about myocarditis, like with the complication. They're thinking, many asked me that question, is this like a heart attack? Is this like the clot that I hear so much in the news? And one of the things that is interesting is that myocarditis happens in adolescents. And there is a New England Journal of Medicine that describe the data, which is pretty similar to this in a way, but there are other viruses and there are other conditions that happen. I practiced adolescent medicine pretty much my entire career, and this is what we see. But parents need to understand that we are not blind about this, that pediatricians know that when they get a young person with their palpitation, meaning the heart beating fast, racing, that there's chest pain, we take that seriously, especially, at that age, any age, but also, when they're athletes. It's not that we can take it for granted and we don't know what it is, that the CDC has to send us a, dear letter to tell us how to do that work. No, we know how to deal with this. This is what we are trained to do. And your primary care pediatrician is able to do the work, the good history, and evaluate what's happening to your son or daughter. And in that way, you need to, that's why I pitch for the vaccination in the community, because you have the link right there that person could answer, evaluate your son or daughter, and give you the recommendations immediately about how to manage that condition, which is extremely rare. But we are not blind to that. We are all trained to be able to take care of your son or daughter if that ever happens.
Thank you. There's some confusion in the chat that's concerned about the virus, the COVID SARS-CoV-2 versus the vaccine. And so we want to, as Dr. Peralta is saying, we have to be very clear in our terminology. And we say COVID-19, the vaccine is not the virus. So Dr. Rob, would you like to make a clarification statement about what is the virus and what is, even though we've stated that, and what is the vaccines?
Well, the virus is called SARS-CoV-2, and vaccines are all made or generate the template, the recipe, as was referred to earlier, for the body to make the spike protein, which confers protection from infection in animal models and clearly in human studies. So if the question or concern is, can you get infected from taking these vaccines? Absolutely not. They do not put together the constituent parts of the virus to form an infectious particle. So these vaccines that we've been talking about today are completely safe in that regard.
Thank you. Dr. Brown, a question says, what do you say to someone who said they don't want to get the vaccine because it's not FDA approved?
So that's a great question. EUA approval, this emergency use authorization, is extremely close to FDA approval. So it's really important to understand that it's not that we're cutting corners, right? That it is very, very close. So there's, a little more, data that they'll get, and I do believe that Pfizer will get full FDA approval based on the data that we've seen so far. But EUA approval and FDA full approval are very, very closely related.
Yes.
It is FDA approved. So the statement was incorrect. As EUA
you have to speak a little closer to the mic. I'm getting echo, Dr. Brooks.
Okay. The vaccines are FDA approved. They got EUA approval, not BLA approval, but they are FDA approved. So that statement was inaccurate, that it's not FDA approved.
Yes, but I think they were speaking about EUA.
About the EUA, yeah.
A full.
And the other thing to think about, importantly, if we waited for another year to study the vaccines, we'd have another 1.5 million people dead. So I think there needs to be an understanding why there was an EUA. The EUA was because we were in an emergency. We are still in an emergency.
Yes.
And so we also see that with the use of these vaccines under EUA, the death rate has dropped. The positivity rate in my county right now is 1%, less than 1%. We were at 30% at one point. So that's because people are getting vaccinated.
Very good. The flu vaccine, will that help the children stay protected? Dr. Rob?
Well, where indicated, it'll help them from the flu. I think one of the big questions we're wrestling with, and I think in July we will see at least one vaccine manufacturer co-administer a flu vaccine and a COVID-19 vaccine to make sure that they don't interfere with each other. You get good responses to both of them, because it would be convenient for the elderly, for all adults, and for kids who are going to get a flu vaccine if you can get your vaccines at the same time. So that work is just beginning. It's an important public health question.
Yes. It's a question about how many variants are there. Who would like to take that? There are many. I mean, we've gone from naming them by country to naming them by numbers, and now we're naming them by the Greek alphabet, and we're at Delta. So I'm not sure what the number is actually of the variants, but as long as the virus stays around, you're likely to see more mutations.
So there are thousands, and the coronavirus, that's what it does. There are people who have spent their entire careers just studying coronaviruses that also produce like the common cold. And the important thing is not to fix your thoughts and on that. It's just like they're very, it is important to know that the CDC is putting the emphasis on the ones that are of concern, the ones that we need to be concerned about, like the Delta that is like, super fast and fit. But the focus should be on getting back to normal, like the young people gave us that very strong message, and protecting them. That's what I would put the message. And, we do answer the questions, but what we know now is our administration is following closely the variants in our country. There is a beautiful site at the CDC now where we can see even by in the different regions in the country, what are the ones that are more prevalent. But again, the vaccination is what is going to stop this. And this is what we need to focus the message. That is the action.
Okay. Well, we're getting close to our time, so I'm going to quickly ask each one of you a question. And there is a question in the box. Let's start off with you, Dr. Peralta. I have one child with WPW and one with epilepsy. Would you still recommend they get vaccinated?
Okay, when you have someone like him with a heart condition and medication, it is important to consult with a cardiologist who is following that child to make sure that that is safe. Once you have that, it's clear. And this is one of the recommendations that I give in the community, because now we have to answer all sorts of questions when we go to vaccinate, but that clearance is very important.
Okay. Dr. Rob, using the known data from countries that we've talked about, how many children under the age of 12 have seriously been negatively affected by COVID-19?
Well, I think all of them. Most of the countries that we've referred to, Europe and Israel, for example, they shut down schools. Right there, every child is injured by this epidemic. How many are sick and sick enough to get in the hospital? Compared to the burden of severe disease in adults, it's a small number. But that's an era where, people are healthy. School-age children don't have a lot of problems. So this remains a very significant illness in that community. I don't actually have the number, and I think there are many parts of the world that aren't tracking the numbers all that well, that aren't that reliable. But there are some, and it's a significant disease in children. And I'll just say one last thing is the best way to protect your children is to get vaccinated yourself, to get your friends, family, and associates vaccinated. And the next thing that's going to happen is variants are going to continue to rise, and we're still going to have intrusion of this virus, even if we get lots of people vaccinated in the United States, until we vaccinate the world. We're going to have to shut this down globally in the long run, so that we're durably protected. I hope we can achieve that.
Yes. The last question I'm going to ask to both Dr. Brown and Dr. Brooks. What would you advise the parents of any children that you're seeing to have their children participate in a clinical trial? What advice would you give them? Dr. Brown first, and then we'll follow it by Dr. Brooks.
I think it's a great way to really contribute to, the data that we have and the safety. So I think if we have a family that's really interested in participating in the clinical studies, I definitely would recommend it for them.
The National Medical Association had a project called Project Impact, Increase Minority Participation in Clinical Trials. The only way we will know if biologicals, in this case, let's see, medications or injectables, vaccines work in the African American community is if we are in the trials. We were about 10% in Moderna and Pfizer in those trials. I believe the same in the J&J. So absolutely. Nowadays, there's something called an institutional review board where we look very closely at the structure of the study of the clinical trial. And were I the parent, I'd have my doctor look at that with me. But I am strongly in favor of having African-American children, adults, people in general involved in clinical trials. The more we do that, the better medicine we will have.
Yes. So as I said, we have a couple of minutes. I'm going to quickly go around the room. I think it's about 3 minutes left. So you have about 30 seconds to give your parting remarks. And I want to thank all of you for this exciting conversation. Dr. Brown, let's start with you.
So thank you. So definitely just want to give families the reassurance to ask your questions, call your pediatrician, vaccinate yourself, encourage your loved ones to go get vaccinated and vaccinate your children. It's the best tool that we have to prevent this COVID disease.
Dr. Brooks.
It is the tool to get to the other side. When people talk about the new normal, we don't really know what that is yet, but one thing we do know as part of the new normal will be having the population vaccinated. These vaccines are safe and effective for children. I feel that this was a good forum. So those that were listening, I think all sides were addressed appropriately. And in the end, a vaccinated child is a safer child.
Dr. Peralta.
We continue, the Black and brown population continue to be the least vaccinated in this country. And my message is let's take action. Let's continue having the conversation with the primary care providers and pediatricians in the community to answer all your questions. And please listen to your adolescents. They have the key. Many times they want the vaccination and they have questions that you could answer, or just reach out to your pediatrician and let's take action.
Dr. Rob.
Well, I really appreciate the opportunity to participate in this meeting this evening, and I hope that we've conveyed information that's at least reassuring and hopefully convinced some that might have been skeptical to go forward and get themselves vaccinated and get their children vaccinated. And I'd like to endorse what Dr. Brooks said is we worked hard to try to get minority representation. And it's such a critical component of representational research that tells us that we know what we're putting out there is working and useful for the communities at greatest risk. The communities of color. So it's a privilege to have been part of this evening. And thanks.
Thank you all. And thanks to our children. As Dr. Peralta said, we should listen to our young adults because they want to be vaccinated to get back to whatever is close to their near normal. And it requires all of us to participate. And it is very important. The data that we are quoting is because we participate in clinical trials. It is very important. Again, thank all of you. And thanks to our listeners and for the questions that you submitted. We will see you for another conversation on another day. But that is it for today. And good evening.